later event is much more severe than the previous one. So that kind of a phenomena which we have been noticing, and all the scientific communities have also recognized that it's not the hazard is important, but the vulnerability is much more important, which we said anarchy. Later on, it was used as a word as that how it is being very, very devastating. And in this particular event, we have joined hand with the UNSCAP. We have joined hands with the SARC tuberculosis and HIV/AIDS this center based at Kathmandu, and weather and climate. This organization is BIMSTEC, Center for Weather and Climate, which is part of us. We have our distinguished delegates, the speaker, the keynote speaker. We have Professor K. Vijay Raghavan, who is the Principal Scientific Advisor to Government of India. Along with that, we have the representative from SARC, that is Dr. Vivek Kumar Lal. We have Dr. Ashish Mitra from BIMSTEC, Center for Weather and Climate, this Noida, and Ms. Tenzin Bonaparte from the ICT Department of UNSCAP, and speakers which we have in the panel, Dr. Madhvi from Sri Lanka. We have Edmund Fernandez, CEO of CSD Group, Mangalore. We have then Mr. H. Offering from Regional Coordinator, Emergency Risk Management, WHO, and BD Gautam, Joint Secretary Planning and Development Coordination from Government of Nepal. Mr. Idris Masood, who had to come here as a member, National Disaster Management Authority of Pakistan, he had this, some very dear ones died in the family last night. So he wanted to join, but he could not join today in the panel, and he has regretted that last moment it had happened, and he had to go for this his home village. So that he has gone there. So he has conveyed his apology and regret for not being with us today. Friend, this is a great opportunity, and I would request Major General Bindal, as our keynote speaker has requested that he would like to speak second. So I would give this forum to Major General Manoj Kumar Bindal to first give the opening remarks and that why we are sitting together here. Major General Manoj Kumar Bindal, please.
Okay, so first of all, I would like to thank Dr. Nagesh Kumar from UNSCAP and Dr. Santosh Kumar for bringing this program together on such an important issue, because we are now in the midst of the crisis and we are looking forward to what should be the future course of action. And we are very grateful to Professor K. Vijay Raghavan, Principal Scientific Advisor, Government of India, for taking out time from his busy schedule and is going to enlighten us with what the Government of India policies are on this regard. I also welcome all the panelists and other speakers who will be coming on this webinar, already introduced by Professor Santosh Kumar, because it would be a great learning to listen from the experts and the practitioners who are dealing with this issue day in and day out. This topic is very important because it has this pandemic has overwhelming human as well as economic cost, as we can see, and it has exposed the fragility of healthcare systems, the inefficiency of the social protection frameworks, with lack of economic resilience. And it is not restricted to developing world. The developed economies have failed more miserably than developing economies in many cases. So this particular pandemic is global in its true nature. And this year 2020 was primed to be a decade of action to accelerate the momentum towards achieving the sustainable development goals. Unfortunately, that has gone on to a backseat because of the pandemic, and the progress that was envisaged right now stunted to some extent. But we also know that every crisis brings with it opportunities for innovation and change, like in 1918-20 influenza pandemic. In that, telecommunication and telephones was introduced in great number because people could not keep in touch with the loved ones during the enforced isolation and social distancing. And the numbers increased so dramatically that telephone operators were not there to operate the switchboards. Similarly, this particular pandemic has also accelerated the growth of technology and innovation, as we see from video conferencing like we are doing today, work from home setups almost overnight. So the current pandemic crisis, which is reshaping the economies and public policies worldwide, it is crucial that we take a moment to lay the foundation for a strong and sustained and socially inclusive response towards international cooperation, technological advancement, and governance innovation without delinking from the SDGs. We have seen in this pandemic how the interdependence of one is country to another and the globalization of the response, how much important and how useful it is uh, in the and that should be the method for future to save on cost and warehousing concerns. South Asian countries, especially, we have seen that uh, a wide range of risk analytics such as impact forecasting, risk informed early warning, indexing, and creating integrated risk matrices to target at risk communities. They have been developed and put to use in response to the various links between pandemic and extreme climate events. So that this itself proves that innovations is the key to protect the community. And so there is a need to enhance the knowledge and understanding on the outstanding challenges and the emerging opportunities which we can uh, draw out from those challenges and increase the resilience of the community. In the past few years, we have witnessed, India I'm talking about, has witnessed strategic sustainable growth development, and we have become a global actor in shaping the narratives and policies in the governance systems. So to ensure that lasting growth and development through partnerships uh, is integrated as an integral part of any country's development agenda, this particular webinar will be very useful for all the participants, because it has been understood that finally governance is the key to effective implementation and coordination of any disaster policies or interventions, and also to coordinate the efforts of the NGOs and civil society along with the private sector, and taking them along with the government policies and highlighting their uh, strength in the government policies. So a thoughtful, concerted effort is required to leverage the existing experience and the technological advancements that we are doing so that we can have a sustainable impact on future disaster resilience needs. Digital health solutions have been found to be very, very effective, and there is a need that we have to move away uh, to a certain extent from the conventional mitigation strategies, and future research should also focus on the combination of hazard and risk maps with the cascading effects of one disaster into another. And this assessing of these cascading effects in long-term planning, though the frequency may not be high, but the intensity sometimes of the extreme events is quite a lot, which is constantly increasing due to changing climate. So the human systems should get interconnected, and the complex and current forecast models should be robust against such cascading disasters. So with this small introduction, today we are here to discuss on what are the pathways to manage a cascading disasters at a national level, at a global level, and how we can actually depend upon each other. What are the mechanisms to be set up to ensure coordination between various countries, cooperation between various countries, whether they be neighboring countries or far off, but due to air bubble, it is possible to reach out to everyone concerned. So there has to be a mechanism for that, for which this particular platform provides a key platform to every speaker to give out his valuable inputs, which we will capture in the form of a report so that it can be used for policy advocation wherever required. With this, I thank Professor Santosh and Dr. Nagesh once again. for this collaboration. And I again welcome the keynote speaker, Dr. K. Vijay Raghavan, to this platform. Thank you so much.
Thank you very much, General Bindal, for giving an opening remark. It is indeed very, very important points which have been highlighted. And Honorable Prime Minister have been debating and have been also taking this leadership role in the region to strengthen the SAARC process, South Asian process, and also that BIMSTEC, and especially taking the science and technology for disaster management. And cascading disaster, no wonder COVID-19 is a classic example for this kind of event, that death and mortality is different, but economy is getting paralyzed. The international trade has gone into berserk. These kind of challenges which are happening, and no better person which we can think of giving the keynote address at this moment, Professor K. Vijay Raghavan, who is the Principal Scientific Advisor to the Government of India, who is with us, and we are delighted to have him here as a keynote speaker. I'm grateful to you, sir, for that you have given us time this morning, and I know that you are a very, very hard press of time. At 11 sharp, you are having your meeting which you are chairing. I'm told about that. Just to mention about one or two things, sir, because we want that I would just like to invite you in the terms of that you are leading India's vision to harness science, technology, and innovations, that STI for preparedness to the future crisis. You also been leading this pathways to build resilience to disaster and pandemic nexus. How India, yes, in the current crisis is dealing with this situation in the diplomatic and also the regional cooperation, and also that helping our own people in the region. And this process, you have been taking a very, very leadership role along with the Government of India. So we would like to listen to you, sir, that how the entire process of regional cooperation can be strengthened and could be taken to the logical end for fighting cascading impact disasters. And we see that a large number of GDP is getting affected and likely to be affected even more. So at this juncture, your intervention would be very, very insightful, and this will give the quality of the vision for all the South Asian nations and Western countries member who are participating in this. I once again take this opportunity to welcome, sir, and invite you to kindly address the audience.
Thank you very, very much, Professor Santosh Kumar, General Bindal. It's a great honor to be here, and with all the other panelists from SAARC and BIMSTEC countries and everywhere else. These are, of course, very trying times. It's important, therefore, for us to be clear how this particular pandemic will cascade and unravel, and what we can do in that context. It's very important to keep in mind that this pandemic was not a surprise. It was predicted for several years. People who had been studying animal-virus interactions have been talking about the threat of zoonotic spillovers happening again. They happen many, many times in human history. And this likelihood of happening has two major changes in recent times. One, the increasing proximity of humans to animal habitats increases the probability of such a spillover, and the rapid movement of people at high density across the world extremely increases the chances of transmission globally and causing a pandemic. Most zoonotic spillovers do not result in epidemics or pandemics. They quieten down rapidly, but they sometimes, as in this case, they can. But there are still major cascading events which can happen even from small epidemics. And this one, a pandemic going across the world, has enormous impact. Keep in mind that disasters such as this, caused by the spread of disease, are different from disasters such as tsunamis, earthquakes, and so on and so forth. Those have cascading impacts in multiple ways in local areas. This has, by its very nature, amplifies all over the world, and its impact can be long-lasting, as we have seen, and it can also have extraordinary consequences. Now, best way to look at the pandemic has been a very interesting metaphor which Jeremy Farrar, the director of the Wellcome Trust, has given. He says that, that to imagine this crisis fully, we should imagine concentric ripples generated by a stone thrown in a pond. And each ripple has a different kind of expanding, cascading impact. I would add to that, before that, to say that the pandemic itself is not just like a stone thrown in a pond, but it's a stone hopping across a pond, creating ripples everywhere. So this is a big, big challenge we have. So the first ripple is the impact of the virus itself. And this results in, all sorts of concerns, illnesses, death, and so on and so forth. And remember that it's not the disease itself which causes this kind of a wide impact, but the fear of the unknown or the fear of the disease. And in many other illnesses which did not spread, there was a similar fear. Jeremy Farrar points out that with Ebola, the consequences of Ebola was a fear in Africa, in West Africa, of the virus, resulting in consequential deaths of malaria and other diseases which were not attended to at that time. So the first ripple is the illness itself, and the second one is the indirect health effects, such as the broader health system. So many other diseases are missed because of concentration in the pandemic, and the consequences of that on our health system is something which we will learn more and more across our countries as we go by. But there's no doubt that the pandemic has prevented normal functioning of the health system, of course, as it has prevented everything else. So first was the illness and the fear which comes with it, and next was the impact on the health system. And the third cascading effect is the social and economic impact of on economies, which is much, much larger. This was particularly evident in our case over here in this region and also elsewhere in the world, actually, where the global supply chains, which were anchored at some very few dominant points, were in bad shape, broken because of the pandemic. So these amplified social and economic challenges of various kinds, and this will have enormous challenges in terms of our recovery. So that is the third aspect. The fourth is that globally, this changes how different countries interact with each other and the rest of the world. Because of the pandemic and because of the economic consequences and the health consequences, there will be consequential relationships which will have to change in multiple ways. Governments have to deal with real or perceived consequences of the way pandemics are handled, and they will naturally protect their citizens, and therefore different kinds of responses you will see all over the world, and we are seeing that all over the world. So these are the four major ripples, and I would like to now go on to say, how is India dealing with these kinds of situations? The virus itself, when it came to India, the response was early and quick in terms of preventing international travel. And the disruption in supply chains was attended to by rapidly much of our industry rejigging ourselves to manufacture, equipment, PPEs, and so on. Our testing labs rose to the occasion by developing indigenous tests and reagents which could be distributed here. So after an initial lag period because of broken supply chains, all this ramped up relatively rapidly. Testing has also expanded hugely. Now, this is an enormous challenge in a diverse country like ours. India is actually a combination of many, many, many different regions all over the world. And therefore, the health system, which has been very well structured, and the disaster management system very well structured to look at relatively, I would say, major disasters, but of different kinds, non-biological, was stretched to deal with this. On the vaccine front, India is one of the major developers and manufacturers of vaccines. 2 out of 3 vaccines which a child uses anywhere in the world the UNICEF programs, the national immunization programs are made in India. So India has got a great strength in vaccine manufacturing. But today, the Indian vaccine industry, our academia, and our research groups also rose to the occasion to develop new vaccines, and many vaccines are at different stages of development, and they will likely go on to trial. So that's a very good aspect. Here, the government has committed that vaccines stockpiled, manufactured, and distributed will be for India and for the world, and they will also be available to our neighbors. So therefore, this is a very important point in our vaccine development, as also in our drug development. This is for the world, and this is not a purpose which is going to be served by having nationalistic views on this. So that's a very important way. Now, going forward, I'd like to end by saying the critical challenge is how long will this pandemic last and what do we do? The range of politics, economics, health, agriculture, citizens, industry, which tied together in a rope in the world prior to the pandemic, which we thought could not be unraveled, unknotted, has come apart. Now it is being put together, and there are two broad routes by which it can be put together. One, it will end up being put together in a similar previous manner, or it will end up being put together in a new manner. This is a situation where we must learn from the previous world what were its weaknesses and see how we can change those kinds of weaknesses, remove them, go for a better world where whole focus is on, in addition to economic growth, sustainable development, but also realizing the importance of focusing on environment and climate change issues. The reasons for this are simple. These are costs to our people in future generations. Over the last 100 years, we have got frugal, cheap, high quality goods by postponing these costs to future generations. So each generation got cheap goods, but the next generation had to pay the cost on the environment, on the climate. It is time now, if one has to deal with disasters of the future, to also factor in the potential costs in dealing with disasters, the potential costs of dealing with environment and of climate, and pay those costs now. Only then will we be able to raise the insurance to put together a system which can protect ourselves now and for the future. Thank you very much.
Very insightful, visionary kind of keynote address which you have highlighted. Simply that you have underlined that it was not a black swan event. It was known, and people were known. And you said that proximity to animal and human is actually leading to these kind of a pandemic. And in this pandemic, large number of cascading impacts which you have highlighted, sir, in terms of the Western Africa and how this Ebola led to the different kind of a cascading impact. But largely you have highlighted that it is influencing our total socio-economic supply chain and economy as a whole. And ultimately it is people who have to pay the price. And this is the kind of a challenges where the government of India's initiative for protecting people across the globe and the indulgence of government of India is a global, in this global scenario, in the vaccine development you have highlighted, sir, which is just not for the Indian people, but it's covering entire gamut of the human 8 billion people of this world. So this is very, very important, and you have highlighted very rightly, sir, that what kind of a challenges which we are facing now at the political level, economic level, social level, justice level, industrial level, so at all levels. And we all, the global community, have to sort it out with the postponing or rather avoiding or rather eliminating this cheap cost process, which we are hampering environment and providing these to the people across the globe. Then future generation must not get affected with these kind of practices. Very insightful, sir, and we are taking this note, and we will request all the panelists to focus on this, that how the global crisis could be handled with the global initiatives, as India has taken initiatives. Countries must come together to fight it out with this endeavor. Thank you very much, sir, being with us as a great time, and that you have we're not told you, but we promised you that we will leave you at 55, 10, 66. So, sir, we are maintaining that promise, and we extend our heartfelt thanks to you, sir, from UNSCAP, from NIDM, from BIMSTEC, and SARC for being with us and giving a very, very kind of insightful leadership keynote address, sir. Thank you very much, sir, for being with us.
Thank you very much.
Thank you, sir.
Thank you, sir.
Thank you, Paul.
Thank you, sir.
Thank you, sir.
Thank you.
Namaste. Thank you, sir. Thank you very much. Now we will move on to the second panelist, and we have now with as Major General Bindal has already spoken and highlighted a couple of points, which as in his opening remarks, and our keynote speaker, Mr. K. Vijayaraghavan, has already given insight. So we would request Dr. Vivek Kumar Lal, because Mr. Raghavan has highlighted this pandemic as a crisis, and everybody is saying that, and vaccine is in the process. And in this particular consideration, that regional cooperation is coming as a big role, and how this SARC is looking at this, and Mr. Vivek Kumar Lal, who is the director of the pandemic, the SARC Center of the Health, and you have a considerable experience in the areas of public health, emergency health system and management. Dr. Vijayaraghavan has also had the biggest stress on the public health, and others ailments are being neglected, which is leading to the larger death. So I would request you to share your experience at the regional level, that how the South Asian nations can actually think of. Dr. Vijay Kumar Lal, I would just request you that how flood and other disasters which is happening side by side along with the COVID, and how it should be dealt with the regional, strengthening regional cooperation. Dr. Lal.
Thank you, Professor Kumar.
Thank you.
Good morning and good afternoon, ladies and gentlemen. It's an honor to join all of you in this well-timed and crucial webinar on how we can apply the lessons learned from this COVID-19 pandemic to leverage towards building a resilient South Asia to counter or manage the cascading disasters through enhanced regional dialogue and cooperation. And I think we all agree that there needs to be a paradigm shift to the way we approach these cascading risk scenarios, and also that it will require a more integrated approach where we combine the public health emergency preparedness with the rest of the disaster risk reduction strategies. And as we all know, our region is one of the most disaster-prone regions of the world, and there are different socioeconomic, demographic, geographical, and climatic factors that contribute to it. And not just that, but in addition to these disasters from natural disasters, we are constantly facing outbreaks and epidemics of emerging and re-emerging diseases of different types, including waterborne, vector-borne, vaccine-preventable, respiratory, and zoonotic infections. And on top of that, the region is also considered a hotspot for emerging infectious diseases, including those with the pandemic potentials, as the current one has also shown. And the challenge here is that most countries have several competing priorities that they have to balance when they look at their overall development agenda. And unfortunately, if you look in general, the health system, and particularly the public health system, remains low in priority and underfunded. And I think there are issues that compound it, including the changing epidemiological and disease profile that is with a double burden. Earlier, there was an epidemic only of infectious diseases, but now non-communicable diseases have surpassed it, and infectious diseases are still a huge problem for us. It creates additional challenges for the countries in integrating the health sector emergency preparedness with a broader national disaster preparedness and response strategies. So as you have rightly asked, how should we go about addressing this situation? Instead of going into the technical details, I feel that there are several already existing and globally adopted frameworks, instruments, and legal provisions with periodic revisions that can be, if we implement in their full spirit, will be able to address many of these issues. And I'd like to briefly touch upon some of them. As we all know, the Uhc Framework for Action 2015, it among other things, called for an integrated multi-hazard approach to disaster risk reduction to be factored into policies, planning, and programming. And similarly, the recent Sendai framework also calls for enhanced cooperation between health authorities and stakeholders at global and regional levels to strengthen country capacity for disaster management, disaster risk management for health, the implementation of international health regulations, and to build resilient health systems. So all these documents already have a broader framework for us to guide as we go forward. And the most important document right now that we talk about, this was Sustainable Development Goal 3, as we know, stipulates that there is a need to ensure healthy lives and promote well-being for all at all ages. And if you look at the target D in Goal 3, it is more specific towards this, calls for strengthening of the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risks. And in the end, I would like to touch upon one that is more pertinent in this context, that is the International Health Regulation of 2005, which is a global legal framework adopted by 196 WHO member states, which is designed to assess the country capacity to prevent, detect, and rapidly respond to public health threats, independent of whether they are naturally occurring, deliberate, or accidental. And there are different assessment tools there which help the countries to measure their current status, identify gaps that needs to be addressed, as well as monitor their progress over time. So, and as we know, the range of public health threats are also broad and diverse. And so to meet all of these, the countries need to strengthen their national capacity for emergency risk management. And not just that, but human health aspect of all types of disasters also needs to be monitored and reported so that there could be an accurate reflection in our overall disaster risk management response. And as we have seen, the large-scale emergency situations cut across international borders, and there are long-lasting social, economic, and developmental consequences. So together with the global frameworks and action plans, some of which I have just touched upon, these observations have also helped us to shift our perception when it comes to managing and preparing for disasters. And as we all know, estimating hazards, vulnerabilities, risks, and building capacity is the only way to preempt most of the natural and human-induced disasters. And so it would obviously require investing more in preparedness and risk reduction than response. That is, we need to earmark more resources for pre-event phase rather than what is right now being done, that is during an outbreak or event. And I would like to again reemphasize that all we need is a change in our approach. We need to break away from the prevailing, what we call a compartmentalized approach, where we look at hazard by hazard risk assessment and also management, so that the different sectors need to come together so that we can improve our understanding, common understanding of the complex systems and risks that are presented by these events, and also collectively identify solutions. So for that, the different sectors need to work together to promote transdisciplinary, integrated, multi-sectoral risk assessment and decision making. And again, in turn, it will improve efficiency and reduce duplication of efforts and allow for connected collaborative action. And to achieve all that, we'll need to ensure major reforms to our institutional structures, to the mechanism of risk governance, to the community organization, and what I feel most important of all, to our attitudes. So I feel that in this context, the regional organizations, UNISCAP, WHO Southeast Asia Region Office, SAARC, BIMSTEC, and others can all play a pivotal role where we build upon the different frameworks, instruments, and the lessons that are learned from this pandemic are applied to strengthen the core capacities of different nations. We are able to enhance the regional cooperation and build a South Asia region resilient to cascading disasters. And with that, I would like to conclude my remarks. Thank you.
Thank you very much, Dr. Lal, for giving this insight and highlighting regional cooperation. There is a further need. We have been discussing and telling about this regional cooperation is required, but that you have further re-emphasized in the context of the COVID and ongoing pandemic, and also that Sendai framework, and then also you took the reference of Hugo framework action and SDG at the region of UNDP. And then you said that how we can improve upon the regional cooperation like BIMSTEC and other regional organizations, South Asian Cooperation, SARC, and need to be strengthened, and also build upon the co-capacity. That is very, very important, that how we are one nation which is good at that we can share with the capacity with other nations. So this is a kind of breaking the silos and coming together, and instead of compartmentalized, we need to look at the insight of the cooperative mechanism. So that is the basic fundamental things which you have underlined in your statement. Thank you very much for being with us, and I am sure that you will be continuing in the discussion and you take part in the other phase also. But I request you to be with us and see that deliberations what is happening. And I'm grateful that your institution has joined in this particular regional cooperation meet today, which we are having. Thank you very much to you for this insightful interaction. Now, thank you very much. I would request now that we have other partner with UNSCAP before we invite Dr. Mitra. We will have Tinzia Bonapes, who is representing, she's the lead in UNSCAP, ICT and DRR sub-program, which SCAP has taken a policy study on evolving scenario of cascading risk. And she is looking into this. She has joined with Dr. Nagesh Kumar and also Dr. Sanjay Srivastava and entire team. And she has been working on this flood health-related hazards in South Asia. So I would request her, first I would like to welcome her, and I would request to highlight some results emerging out from this study which UNSCAP has already undertaken. So welcome Dr. Tinzia Bonapes, and I request you to kindly be and share your key findings with the study.
Thank you very much, Professor Santosh Kumar, for that kind introduction. And dear experts and colleagues and friends, I'd like to start off first by warmly welcoming everyone to this second in a three-part South Asian series on building resilience to cascading disasters through regional cooperation. SCAP is very pleased to have the opportunity to be jointly organizing this webinar with our friends from NIDM, the SARC Tuberculosis and HIV/AIDS Center, and then the BIMSTEC Center for Weather and Climate. It's a real pleasure to have this opportunity to partner with you all. And so, dear friends, even for a region that is no stranger to disasters, the intersection of the pandemic with the monsoon season is creating challenges that we have not dealt with before. At our first webinar, it was clear that we need to build new disaster risk scenarios supported by integrated approaches that can assess and address these ever more complex risks that are presenting. And to take forward this recommendation, as you mentioned, Professor Kumar, SCAP has done this. We have prepared a study, and the study is available on the event website, in which we have, hopefully in a seminal way, expanded our understanding of the disaster risk hotspots in Asia Pacific. We did this by integrating the biological hazard risk within the disaster riskscape that formed part of our 2019 Asia Pacific disaster report analysis. And our results show that natural hazards, health hazards, and endemic risk drivers interact, augment, and feed off each other to create hotspots of cascading risk. So we are moving from the riskscape to a much more dynamic and cascading risk scenario in which many different drivers come together and strengthen each other. So allow me just to share a few of the key findings and 3 potential policy messages for further discussion over the next hour and a half. First is that the disaster riskscape of the Asia-Pacific region expands and changes significantly when biological hazards are added to natural hazards. Our report in 2019 notes that within the realm of natural hazards, there are 4 distinct hotspots in Asia-Pacific, where fragile environments are converging with critical socioeconomic vulnerabilities. But this study, when we add the exposure to zoonotic and vector-borne diseases, we see that South and Southwest Asia, followed by Southeast Asia, are overall highly exposed to both natural and biological disasters. Second, among the subregions of the ESCAP region, South Asia is where the overlaps between the natural biological hazards, climate change, and socio-economic vulnerabilities are at their most complex, with grave implications for the achievement of the SDGs. In South and Southwest Asia, more than in any other sub-region, the records of major disasters show that social sectors suffer impacts that perpetuate inequality of opportunity. In addition, recent years have seen new disease outbreaks and emerging infectious diseases assuming pandemic proportions, causing further social and economic disruption and ultimately becoming endemic drivers. The standard of living and the health status of people with regards to their nutrition, as well as the sanitation problems that arise in overcrowded urban areas, all further exacerbate the situation and lead to vectors breeding and vector-borne diseases spreading. And so our study maps the hotspots of these multiple risks in the sub-region, and it also shows how by building an early warning system and by building a composite risk matrix which accounts for endemic, natural, and biological hazards, we are able to identify and stratify districts or areas into their appropriate risk zones. Third, the composite risk matrix shows the critical need for integration of disaster and health management systems, as the cascading impacts of COVID-19, the floods, the recurring biological hazards together are overburdening the health systems in the sub-region. And so in the study, we have identified healthcare infrastructure in red zone districts that are not only stretched thin from the COVID pandemic, but are now also exposed to infrastructure damage that occurs during large-scale funding, while further support is needed for the increased incidence of dengue and malaria that go hand in hand with widespread flooding. So measures for building resilience in both disaster management and health sectors call for integrated cooperation between the line Ministry of Health, Disaster Management, and the planning ministries. And 2020 represents our window of opportunity to really make this happen, because never has this intertwined linkage been as strong as in 2020. So noting these findings, I would like to propose to our esteemed speakers and panelists that we could organize our discussions today around 3 points. First is the need for us to establish early warning systems. And this is urgent, and not only early warning systems, but multi-hazard, given the interlinkages. And we need to think about how multi-hazard early warning systems can really be seen as regional public goods, and how we can best support the establishment of such a public good across all countries. And second, building resilient infrastructure also needs to be seen as a public good. And here, what policy regimes are needed to incorporate resilient infrastructure as a public good choice, and also what financing mechanisms may be needed to bring this to fruition. Lastly, the Asia-Pacific Disaster Resilience Network, which has been established by ESCAP to support integrated multi-hazard early warning systems and to close data gaps therein. We look forward to hearing from our experts on how the sub-region can take advantage of this network and can build future resilience to all hazards. Thank you very much, Professor Kumar. Over to you.
Thank you very much, Madam Gopane, because that way you mentioned in your presentation about the study which SCAP has carried out. You are talking about the composite risk matrix. That is very, very important, which qualifies, not only identified, but also stratified that what kind of engagement, what are the needs are there. And you said it, this is the time COVID-19 has given us, that how the public health system that get integrated in the disaster risk management system. And you also prescribed 3 important measures to be taken by all the nations, member nations who are getting affected by these multiple hazards, cascading disasters. One is this to strengthen early warning system. Second, you said investment, prudent investment in resilient infrastructure. And the third is that if, the strengthening the network of APDRN, which the SCAP has established. An early warning system is the key in terms of how we can actually draw the dividends of the investment which we are making in the region, and not for one country, but for also that all the countries, whosoever is making investment in the infrastructure, we're talking about disaster management as a public good. And we see that which part is public good and which part is a private good, but is important to look at as a public good component in the early warning system. And no better person than Dr. Mitra, who would be giving an insight on this, that how this the regional cooperation where she is talking about, and you are leading this BIMSTEC Center of Weather and Climate Center, and you have been not here only, but in the past also, Dr. Mitra, you have been contributing as a scientist and as a lead person, known as a climate scientist. So your insight on the risk matrix would be very, very important. So Dr. Mitra, once again, I welcome you. I take this opportunity to welcome you and also BIMSTEC at this particular point of time. And I wish to hear from you about how you are taking this forward and recommending some of the actions to be taken for the future. Dr.
Thank you, Professor Santosh Kumar. Good morning, esteemed panelists and dignitaries on the panel and dear participants. So it's a great pleasure and honor to be on this platform and discussing the pathways to manage cascading risks and protect people. So I believe it's not only protecting, but empowering the people, institute and societies and governments. So we have seen during the recent COVID time, unfortunately, there are so many hydromet disasters like cyclone, Amphan, Nisagra, and we have seen in South Asia a lot of flooding in India, Bangladesh, Nepal, and many other places. Particularly the cities in recent years has been affected by urban flooding, and the consequences with the background COVID, people are suffering from COVID. And when we see in the TV added to that COVID situation, how people are managing with these disasters, hydromet disaster. It's very unfortunate, but the good thing is we have now good early warning systems which are in place. So fortunately, in our region, in the South Asia, and particularly in India, we have state-of-art new early warning hydromet early warning systems called the numerical models, which are being run on supercomputer with a lot of satellite data. So we have seen the early warning part in different time scale, like short and medium and extended and seasonal scale. We are in a position to handle them. And if we see the South Asia and the BIMSTEC countries, we share the same climate system, and the manifestation of these climate systems to the regional patterns. That's the area which we need to work more closely. So we have the technology like supercomputer, satellite, and the early warning models. But how to translate this model output to real applications, integrating them to disaster framework is the real challenge now. And currently, our Government of India's policy, Neighborhood First, we are implementing that. So Prime Minister has emphasized that Neighborhood First policy that comes in the disaster early warning and all other aspects also. So regarding this BIMSTEC Center for Weather and Climate, which is the output of this BIMSTEC cooperation, it's one of the center which is functioning from 2014. And this National Center for Medium Range Weather Forecasting, which is doubling as this BIMSTEC Center for Weather and Climate, is located in Delhi NCR, Noida. And we are looking after the requirement of the BIMSTEC member countries hydromet department. And in coordination with the BIMSTEC Secretariat in Dhaka, we are able to establish contact and consult them. And recently, the BIMSTEC Secretary General visited this center in Noida, and he highly appreciated this center and what BIMSTEC cooperation. So basically, there are three components, I will say, that you need state-of-art weather and climate models, which are nowadays we call it seamless models, and the same model is used across scales from very short scale in the city to the global scale. That's the spatial scale, and in time scale, it can give early warning from hours to a season. So that's what in India we have, and these systems are also available for sharing with the BIMSTEC countries. And to run these models, we need a variety of data. So fortunately, a lot of satellite data due to international cooperation is available, but that is another area we need more and more regional data to make the model better and verify the model. So that's the area we need more cooperation. And so we have now early warnings working very good in all the scales, short, medium, extended, we call it multi-week, which is a short-term climate prediction, and also the seasonal prediction. So these are being used mainly for agriculture and water resources management, but we have to now integrate this product to multi-hazard scenarios and also to now this disease and public health system. And because the model skill has improved in recent decade, so there is a lot of opportunity to use these models in multi-hazard scenario and particularly to the health sector. And what we practice in the shorter time scale, short-term climate scale up to a season, can be also used in the climate change scenarios for mitigation and best practices. So what is required now is we have good technology for hydromet early warning system, but how to integrate this Arch system modeling framework into areas. And I'm sure the technology has developed in the disaster risk management and decision support system. So there is a requirement of integrating all these things to make a final system which will be beneficial to the society and people of this region. So with that, I will stop here. Thank you, and I look forward to working closely with the regional partners on this.
Thank you.
And related.
Thank you very much, Dr. Mitra. You have very rightly mentioned what she is, that issue of early warning system as a public good. And you mentioned that how climate and weather forecasting center is contributing and is strengthening the co-capacity building as a regional cooperation. And that BIMSTEC initiative for integration of multi-hazard model, which you prescribed, that we should be taking it forward. And you mentioned that how since 2014 BIMSTEC have been able to strengthen the regional process, and that we are heading towards this regional forecasting model. You mentioned time, scale, spatial modeling, and all seamless model you talked about. So this has an implications, and see that many countries who get affected, like Bangladesh and India, got affected in the same point of time when the COVID is affecting both the countries together. And there that you needed the warning system. So, and other countries also get affected. So thank you very much for this highlighting this point as a need for multi-hazard warning system, including the health system. This is a very important point that you have brought in, that how health factor can go into whether epidemic or pandemic can go into this early warning system pattern. So this is a new dimension which you have added, and thank you very much that we all were. We will come back to you again, and I wish you would be here. We have
Thank
our
you.
Thank you as a panelist from Sri Lanka. And Sri Lanka, we have been saying that they also got affected in tsunami, and currently they are also affected in the COVID-19. So, and their pandemic is there, and the other disasters are also into playing. Cascading disasters they have been seeing as a landslide and this cyclonic storm. So, how we can move from here? That we have Madhvi Malagoda Aryavandu, who has served long years in the United Nations, but now currently is she's the director of the Duryog Nivaran South Asia Network for Disaster Mitigation. So I take this opportunity to invite Madhvi. Are you there?
Yes, I'm here, Professor Santosh. Yes.
Thank you very much for being with us, and I need your intervention. What you have to say at this point of time?
Thank you very much. Good morning, everybody. I'm so pleased to join this session and the panel of speakers this morning to share some thoughts on this very timely topic, focusing on the key highlights from a series of recent discussions, Duryog Nivaran South Asia Network for Disaster Mitigation, conducted starting from last June. Let me also say that Duryog Nivaran appreciate the opportunity to share the learning and recommendations of these discussions at today's webinar, and thank UNESCAP and National Institute for Disaster Management, India. So as we captured natural and technological hazards which did not wait in the pandemic, actually brought a very serious compounded impact that humanity has never faced. It is estimated that on average 2 disasters per day occurred in the Asia Pacific during the period of the pandemic. Above all, the pandemic highlighted the existing disparities in society, in development practice, in disaster and climate risk management approaches. It highlighted issues related to policies and practice, showcased the issues related to groups who are specifically vulnerable, rights and regulations, lack of awareness on rights, gaps in systems to protect the rights, gaps in data, documentation. So Duryog Nivaran conducted 3 webinars starting from June 2020 on the topic of colliding disasters, which is also the topic of today's discussion. So the 3 topics were managing in the context of colliding disasters, women and work in the pandemic, resilience, city and risk, achievements and opportunity. I will very briefly share the main recommendations and the key highlights from these 3 discussions. So let me first share with you the key highlights in terms of what has worked in practice. Taking the example of the management of cyclone Amphan, which affected India and Bangladesh during the height of pandemic. So what worked, as it was shared by the both governments and the partner organizations, adapting the existing disaster management structures to comply with the health and safety related protocols operationalized for COVID-19 and implementing them at the local level during the cyclone preparedness and at the evacuation during and managing the cyclone shelters. This included revising the protocols for cyclone response, informing all stakeholders, adapting early warning systems to combine both cyclone and COVID-19 warnings, safety equipment for volunteers and teams in cyclone shelters, and increasing the availability of shelters and taking steps to facilitate social distancing. Obviously, this involved a lot of new thinking and lot of work, but this is what helped to manage the situation as effectively as possible in the unexpected situation of managing the cyclone during an unexpected pandemic. Secondly, galvanizing stakeholders and actors such as private companies, faith and religious groups, non-governmental organizations, also a very effective strategy. The creation of forums to coordinate between the government and civil society organizations to facilitate information sharing and cohesive response to the pandemic have been an important step, because taking into account that the expectation of the main role, the government playing the main role, still the role of the civil society organizations and the private sector taking on a supporting role to the government showing that support as well as the reaching out to the community was very effective. So this contributed to increasing communication and cooperation between central and local government bodies, as well as like creating an example for whole of society approach in making the response to the pandemic effective. Migration, people in migration was a key, was highlighted as a key issue. So the monitoring the migration and movement of groups of people and obtaining information about their nature of employment, their living conditions to recognize vulnerable in order to provide relief again was a key factor which required very specific attention. And then another point highlighted in terms of what worked effectively was encouraging cooperation interregionally and between the state and non-state actors on disaster management and planning while utilizing existing systems and more collaborative approaches, including community participatory networks to serve the purpose of disaster management, also looking into the future, especially are local and must manage locally. This was actually shown in example. Several points were also highlighted in the discussions. What were the pitfalls to be avoided? Let me share those with you now. Communication was a major issue because there were multiple channels of communication, the formal channels of communication and the social media, the various forms of informal communication. So unclear communication and lack of transparency was a major challenge. When stakeholders and communications don't have access to clear information, misinformation, it was apparent that misinformation became a major challenge. So this is a pitfall to avoid. Irregular data collection and improper data management. In crisis situations, everybody experienced clearly data is vital and inefficient data systems can impede response. The third pitfall to avoid is lack of planning and preparedness at a state level. Lack of income support and livelihood support schemes and plans as well as planning for other potential disasters, hazards that may arise can result in dire consequences which could have been avoided. And the final point in pitfalls to be avoided is duplicating structures. Creating new structures, committees without using or disregarding the existing ones, especially within the disaster management system, can cause unnecessary overlaps and create redundancy in the long run. So the three webinars also made some specific recommendations. Let me, in the interest of time, just pick a few key recommendations. First, following also the recommendations of the Sendai framework, I don't think the pandemic really showed any new recommendations for effective disaster and climate risk management. It is basically highlighting and re-emphasizing. So investing in disaster management on a macro level, particularly in high-risk areas, funding the construction of resilient homes and buildings, and investing in disaster prevention came as one recommendation. Digitalization of data and information and disaggregated database preparation at a local level. Additionally, making this information readily accessible and digitized for future disaster response, and having it available for multiple actors for a more coordinated response and for follow-up, as in the case of wage workers and migrants was specifically highlighted. Then encouraging cooperation interregionally and between state and non-state actors on disaster management planning in using the existing systems. A specific point on gender-related issues, which the pandemic over and over again highlighted what we already know, which arose clearly during the times of disaster and crisis. So, importance of formulating support systems to address issues such as gender-based violence, vulnerability of women-led business and sole female breadwinners, increasing resources and facilitating access for pregnant women, elderly and vulnerable groups were highlighted. And livelihood support, the need that they should be prepared for those facing unemployment, deal with migrant needs and wage workers beyond the health aspect. Greater planning and anticipation of vulnerabilities is requirement for greater planning to address vulnerabilities in compounded disasters was highlighted. So as a few key messages, let me take just my one last minute. Now we need to prepare new SOPs because they need to be changed since the risks are now not isolated. If we have standard operating procedures for cyclones, floods, droughts, now the risks are not isolated. So we need to think about preparing new standard operating procedures for compounded disasters. Of migration process need to be addressed in much more seriously also for compounded situations. Attention for disaster risk reduction governance. Protection mechanisms need a new way of thinking. The way they were, we all could see they were not adequately shock responsive for this kind of pandemic situation. Particularly the schemes were missing middle population who were not part of poverty reduction programs, who have now fallen into the near or to the below poverty level. So the social protection mechanisms now need to think of including different groups of people. Consider universal health coverage linked to the universal social protection, because the health aspect together with the social protection now need to take a new point of view. And finally, getting back to the new normal should be greener with eco-based greener approaches. So building back better now, the new term we can think of greening back better, and from government to governance, engaging communities, involving disaggregated data, young people that can help bridge the digital divide, decentralization of governance, and gender and social inclusion in the information processes. Thank you very much.
Thank you so much, Madhavi, for bringing these issues related to gender, social protection, empowering people. What um, Dr. Mitra also mentioned is not only protecting, but we need to go for empowerment. So you have highlighted also that key webinars outcome, and you shared that as an important with how the issues of migration and strengthening of social protection system, and we have to move on from government to governance, and that is the real new normal have to be dealt with. That lot of distress, poverty, and other things are increasing. What the keynote speaker, Professor K. Vijayaraghavan, also highlighted, the pandemic is one, but socio-economic is another, which is very, very challenging for the future to address. And in this context, it's no better person that Dr. Edmund, who is talking about that he's a medical professional and he's a doctor, and he's seeing this risk as a different person. So when we talk about interacting risk, interconnected risk, compounding risk, and cascading risk, we all have this kind of an interplay which is coming to the finally landing up to the health of the people. And Professor Raghavan also mentioned that it's not only that people get affected by pandemic and mortality, but other ailments also need to be looked at in terms of risk, which gets neglected at the time of this kind of a pandemic crisis. So Dr. Edmund, you need to just highlight that how this complexity of risks and getting impacted on the people, and how this as a public health system and as a doctor, the South Asian nation should deal with this in future, in times to come. And as Dr. Raghavan also mentioned, this is not an uncertain, and it was not unknown. The pandemic was known. So how one should prepare for the future now?
Thank you, Professor Santosh. A very good day to each one of you joining us across the seas and oceans, lands and hills across Asia and South Asia in particular. At the outset, let me extend my warm congratulations to UNSCAP, friends at NIDM, and other collaborators whose work I've been following closely over the years, and which continues to remain an inspiration for the kind of global South we aspire to build. I'm particularly very thrilled to observe that we have sectoral experts cutting across all levels of involvement, so 100 on 100 to all the organizers. Let me draw your attention here that a perfect storm is now brewing in the South Asian region, which faces cascading risk in triplet: natural disasters, climate change, and biological disasters, along with a pandemic like COVID-19, calls for extraordinary resilience. But while we do this, we need to integrate the processes of disaster management and health risk that faces this region. This is reminded of one of the incidents where I've worked in. Imagine a poor family of 2 adults and 3 children. The adults are now going through an unemployment due to a pandemic like COVID-19, and suddenly they're faced with a flood situation which has destroyed their home. They've lost their livestock. Few days into the floods, the adults have now suffered from a full-blown dengue fever, and in hospital they stand in need of blood platelets for survival, depending on the mercy of an overwhelmed health system. Don't you feel the burden of this cross is too heavy to bear? What happens to the adults? What happens to those 3 children? How do we create a future that leaves no one behind? This situation leaves us as stakeholders with 2 questions. What can we do for them is question number 1. What can we learn from them is question number 2. As stakeholders in the risk reduction process, Plugging the cascading risk facing the region becomes of paramount importance now than ever before. Flooding and cyclonic storms have direct implications on waterborne diseases, vector-borne diseases, and also affects chronic diseases like diabetes, cardiovascular diseases, kidney ailments, particularly those suffering from chronic kidney injury, and to some extent, skin infection as well. I have personally treated patients across these spectrums during Typhoon Haiyan 2013 in Iloilo, Philippines, and I also see some of my colleagues from Philippines have joined this year. During the Nepal earthquake in 2015, Chennai floods in India in 2015, Kerala floods in 2018, and very lately as Cyclone Fani in 2019. Droughts also have direct implication on malnutrition, where the cycle of malnutrition starts building up. From 2 square meals a day, it reduces to 1 square meal a day and propagates the cycle where malnutrition, decreased rainfall, agriculture and crop losses, and droughts work very comprehensively in further propagating the disease burden. This also has implications on waterborne diseases, usual sanitation and hygiene practices, which get compromised and often are taken for granted within the communities. Earthquakes also come with their baggage of damaging critical health infrastructure, besides causing injury, post-traumatic stress disorder, and a mental health imbalance. What do we then need to do? Addressing these risks call for a new algorithm and an approach that pushes for a public health in all disaster policies. Let me repeat, this pushes for a public health in all disaster policies. When I mean public health in all disaster policies, it means that health must be approached from a social, commercial, and a legal determinant of healthcare, which has the snowballing potential to plug existential gap in the process to mitigate risk that the region faces. Naturally, so to say, cross-sectoral convergence will remain very crucial for regional cooperation among countries in putting risk-informed planning at the heart of development. A new framework drawing inspiration from Sendai, from Bangkok Principles, and also the 2030 Agenda for Sustainable Development Goals will mean that we implement and retrofit health centers at the primary level, at the community level, and at the tertiary level of health system strengthening. Doctors, nurses, allied health service providers, and my colleagues are all taught to look at human body, to inspect a patient, to palpate a patient, to auscultate a patient and diagnose disease. But what we will now have to do moving forward is to prepare doctors and nurses to be disaster prepared, disaster responsive, and disaster alert to practice medicine with limited resources. Why do I say practice medicine with limited resources? Healthcare providers working in hospitals work in comfortable environments with access to each of those requirements within a space of, say, 10 to 20 meters. But when you go to the field, you start practicing medicine on the field, this calls for challenges. I mean, a number of times where I have worked, I've not had a nurse, I've not had a pharmacy assistant, I've not had a lot of comfortable things which I would otherwise have access within a corridors of a health system or a hospital. What would this mean? I would like to leave all of you with a few points to consider in framing policies back at a regional level, at a national level, and at a state and local level. At a regional level, we as stakeholders must consciously adapt to a multi-risk hazard cooperation mechanism and engage in shared global health diplomacy to shape risk-informed approach for the region. At a national level, efforts in South Asia will need to address cascading multiple risks while engaging in regional cooperation to align with 2030 agenda and to also ensure that extreme weather events do not become a watershed moment for developmental process. And this does not lead to a collapse of the health system, but rather strengthen it time and again. Convergence of line ministries at the national level, which includes disaster management, health ministry, planning ministry, women and child, rural development, all of them will have to come together. I mean, it's very easy to work in silos, but putting in coordinated mechanism effort calls for work. At a state and a local level, engage disaster management authorities to revisit their DM plans and integrate a public health response very comprehensively. This necessarily means that we have outbreak investigation, we have emergency medical teams, and we have hospitals and medical college involved into the DM plan that we prepared, notwithstanding the involvement of non-government organizations, which is crucial as a backbone and the fifth pillar of any democratic process that governs us. Preparing health workers in the region to practice medicine with limited resources and challenging environments is something that we need to move forward and think through. This also means keeping in mind antibiotic resistance that faces the region. If an infected person or a patient comes to a clinic in a field, there is no point treating every patient that comes with antibiotics like amoxicillin and clavulanic acid, because you are slowly and unconsciously building up antibiotic resistance, which has been a matter of global concern. And it has been equally amplified by the World Health Organization as well. Hospital preparedness plans need to be revised, being mindful of these cascading risks, and field hospitals need to be identified and kept on standby at all times as we move forward in shaping the risk-informed planning and also thereby subsequently building resilience within our state level, within our local level, within our national level, and within the region of South Asia, Southeast Asia, and the Asia Pacific at large. Over to you, Professor Santosh. Thank you very much.
Thank you very much, Dr. Edmund Fernandez, the CEO of the health sector, CHD, you are leading with. And you have emphasized a couple of very insightful examples by bringing all the impact on cascading disasters. And you did mention about the drought also. But so that is a very, very critical component, and revisiting all the plans which we had, whether the disaster plan or the hospitals plan which we have, and with the limited resources, how that practitioner should start working with acknowledging this pandemic as a real challenge, where you are talking about social and legal and all should be together. And in this pandemic, you said that we need to have hammer all the time for the cascading disasters into account while revisiting. I see one or two while you were making presentations, some questions which came up. I would highlight to you and also to World Bank, the WHO, who is going to be the next presenter, because they are mentioning that this Global Water Partnership is working on this drought management plan at the global level and water-related hazards with their health. So they are highlighting in the question that how it is also impacting the health and pandemic severely. So this these kind of work also to be integrated when we are talking about the regional model. And you did rightly emphasize that the policy to the local level, regional to the local. Thank you very much for bringing those points, and we will come again to you. And this is the opportune time to request Dr. Rodrigo, but you have highlighted about this Fernandez highlighted about WHO's role as well. And WHO is in the thick of the whole affairs when we're talking about the COVID-19, the new normal, and along with that disaster manager and the people, they are struggling with the flood situation and also that cyclonic storm. So Dr. Rodrigo, how you wish to formulate your points as a recommendation at this point of time for the future for the entire region. Dr. Frederick.
Yes, thank you, Professor Santosh Kumar, colleagues in NIDM, and thank you to all organizers of this webinar and for this opportunity. I also thank Dr. Edmond for setting the scene and the scenario. I'll be walking you through a publication we did 3 years ago. It is Roots for Resilience, and it is actually looking at a different way of assessing risks. Maybe the risks are not cascading, but we never measured them in a more analytic way to inform our policies and our preparedness plans. So I'll begin with the risk profile in the region, the results of our new way of looking at risk assessment, and ways forward, and then conclude from that. Next slide, please. So this is a publication which we have put together in 2017 to really look at the idea of what is an all-hazard preparedness. What do you need for that? And it is all about putting together risk profiles, overlaying vulnerability mapping, capacity mapping, so that we know very well where to prioritize our resources and mitigate those risks, whether they are seasonal, emerging, or novel. This publication provides the routes for and the routes towards resilience. Next slide, please. So we have coexisting complex hazards, risks, and vulnerabilities in Southeast Asia. In addition to sudden and novel threats like COVID-19, we have a background of hazards. So when we say there are floods and cyclones, we know that some of this actually that this happens regularly. It is not a surprise. There are health risks. There is a background of infectious diseases, whether it's TB, malaria, dengue, seasonal influenza, and our existing vulnerability profile. Mobility of populations, the elderly, health status of women and children, etc. There are also emerging and re-emerging health risks caused by hazards such as adverse climate changes, whether it's a sudden acute onset natural event like earthquakes. Health risks, emerging and re-emerging high-threat pathogens, Nipah virus, Zika virus, Ebola, chemical, biological, radionuclear threats or events, accidents usually, are also health risks. So how do we bring this all together and make sense of it, rather than taking it separately as events and then say that the risks have cascaded? Over. Next slide, please. Yes, so we begin first with the background. What is the burden of infectious diseases in Southeast Asia? Southeast Asia has 64% burden of measles and 36% burden of TB. 33% of upper respiratory tract infections and the burden of 52% of cases of dengue. In terms of communicable diseases alone, in terms of DALYs lost, higher than the regional average in 6 of 11 countries that we cover. That's Bangladesh, Bhutan, DPRK, India, Indonesia, Maldives, Myanmar, Nepal, Sri Lanka, Thailand, and Timor. For Myanmar, it's around 46%. For Nepal, it's 49%, Timor 58%, India 44%, Bhutan 44% as well. Emerging and re-emerging infectious disease hotspot, that's practically Southeast Asia, South Asia, for Japanese encephalitis, Nipah virus disease, Zika, leptospirosis, Crimean Congo hemorrhagic fever, avian influenza. So we have a whole lot of these diseases that have epidemic potential. And of course, as mentioned by the previous speaker, even malaria, antimicrobial resistant diseases or bugs, such as what we see now, also artemisinin resistant malaria. It is important because Southeast Asia region accounts for 1/4 of the world's population, 30% of the global disease burden, and the highest proportion of global mortality. Next slide, please. Just to illustrate that this was a study in 2017 where global hotspots of emerging zoonotic diseases, and if you look at the countries of South and Southeast Asia, that's where the hotspot is. Next slide. So what we have done in this publication is to use the INFORM Index and look at vulnerabilities and risks of countries around first natural hazards. So there are 5 natural hazards covered here: earthquakes, cyclones, floods and landslides, and tsunamis, plus droughts. So now you have to overlay this with your some measurements of capacities for the health system. We looked at this. So just press. See, so across these several areas of capacities for universal health coverage, which is an index used by the World Bank and WHO, press it again. We just see that we are either around 55%, 60% capacitated on a regular day without an event, as per the health services, the availability of health workforce, the financing, and as well as essential medicines and drugs. A few countries are above, way above that, but it's a little bit above mid-range. This is just the main message around this. So think of an earthquake, a sudden event, you're just above mid-range in terms of your buffer capacity to these health system elements. Next slide, please. So again, we begin with the overlaying now everything in terms of risks for natural hazards. This is how green the map is. So when you look at this, it's just a matter of anywhere from moderate risk to high risk across those 5 natural hazards. Next, let's look at specific diseases. Okay, so for a hemorrhagic fever that has epidemic potential, that like Crimean Congo, hemorrhagic fever in terms of presence of the vector, etc., events recently, you see again that it is moderately high risk. Very few are moderately low risk to high risk. Next. For cholera, moderate risk to high risk. And next. Japanese encephalitis, the same. And next. For Middle East respiratory syndrome, it's also a SARS variant. It's a coronavirus. We were looking at this because of movement with the Middle East. It is also moderate risk to high risk. So we used a way of ranking on this with the tool that is used for assessing risks, the DAISY tool. It's around 31 variables that you look at for looking at ranking or at least assessing a certain qualitatively even the risk for certain diseases. So by just looking at this map, the region is fairly moderate to high risk for any event, whether they are natural hazards or any of these biological hazards, and that we have to look together if we are to do comprehensive preparedness plans. If we just say we have an earthquake preparedness plan, but nothing for landslides or nothing for a possible dengue outbreak or nothing for a possible cholera outbreak, this should also inform how you will plan for a certain event if it happens in a locality. Next slide, please. Yes, so this one was Zika virus. Zika was the disease then, again, moderate to high risk. It was endemic in Southeast Asia at that time. Next slide. Yeah. So how do you assess capacities? Now, here's the problem. We assess capacities fairly independent of these risks, whether they're natural hazards or biological hazards. IHR is one. The IHR, the International Health Regulations, has a self-assessment score. Recently, after the Ebola outbreak, there is also a joint evaluation methodology that applies. And if you see, the capacity assessed is that you are a bit high, 90s, 80s, very low it's always low in chemical, biological, radionuclear events, as well as points of entry and RISCOM. That's a very consistent self-assessment of countries. But it's almost like seen as whether the capacity is present or not, and not interpreted in a way where multiple risks are involved. Next slide, please. This is the Uhc Index. That was the first map I showed you, where the health system capacities are anywhere from let's say mid to high range, and that number is by country. So it's a bit different, doesn't apply to the previous frame. Next slide. Southeast Asia, our program in the regional office had a series of benchmarks where you have to bring a multi-sectoral assessment of your capacity. And look, for the most part, the average was much lower. So here it also tells about the methodology of how you assess your capacities. It has to be something more multi-sectoral, something more national to subnational, rather than averages, because you will never be able to pinpoint where your vulnerability is for a certain event or a certain risk. Next slide, please. So the cascading impact of disasters, by knowing for whom you are making policies for, doing needs and risk assessments, for risk-informed guided policies. This is the most important part. And when we say risk-informed, it's not just one hazard across one hazard. Considering practical, actionable, holistic, realistic, and implementable approaches. I think Dr. Edmond gave us some points around that. Planning interventions and assessing progress through monitoring and evaluation, and do course correction if necessary. This is a cycle. You have to keep doing it. It's not that you had one plan and you're done. Documentation and replicating the process with customization and improvements in other places. So you might have started with one district and you move to another, or one state and then to another, or a province, and then you tweak it because it's not always the same. Your risk profile, your comprehensive risk profile will be a bit different. Next slide, please. So priority areas of intervention, we have to move subnational in terms of comprehensive risk assessment or risk profiling across all hazards, and understand that together. Otherwise, we will always say, that it's everything is coming together, etc. They were always there. It's just that in terms of events, they get exacerbated. Health emergency preparedness programs, that's how standard systematically you can go from subnational to areas, and then put that together at national level. Biosafety, chemical, biological, and radionuclear events, preparedness and management, prevention and control of antimicrobial resistance, strengthening local surge capacity, logistic deployment, etc., and points of entry. These are some priorities that we've seen in when we did the assessments. Next. So the publication also puts together some form of pathway that actions should be at subnational level, and that should begin with this same risk assessment methodology proposed at subnational level, supported at national level, so that at regional level you have you can say that it's built from the base. Regional capacity and regional resilience can move if you are strong at subnational, and especially the concept of health security. You are only strongest at your weakest link, and every outbreak that has begun has started, or even this pandemic has started at a vulnerable place, and has grown, spread in very vulnerable places. So next. I think I will end with a bit of leveraging global frameworks. We don't have to write up new things. It's just use what is already there. We have the health-centered aspects of Sendai framework with the Bangkok Declaration, the NDMA plans and policies and acts. Every country has that. Early warning and response systems. Just keep leveraging this. I think COVID is a pandemic, it's an emergency, it's also an opportunity to now focus investments around this. In Southeast Asia, we also have a Southeast Asia Regional Health Emergency Fund, which countries contribute to with a preparedness stream. So that's fairly important. It's the investment. The papers can be there, the policies are nice, and the plans are nice, but there is no investment. Regional strategic plan to strengthen public health preparedness and response is something we were doing for some time. So leverage what is existing at every level. Next slide. I think I will end with these takeaway messages. This is actually how we summarize the Delhi Declaration for Strengthening Preparedness, which was signed by Ministers of Health of the Southeast Asia region last year. It's the 4 I's. Identify risks in the way I just presented. Invest in people and systems for risk management. It's not just about preparedness or response. It is about the whole cycle. Implement these plans that there has been investment in, and interlink sectors and networks. All our vulnerabilities that have been seen in this current pandemic are in any of these areas right now. So this is the time to kind of bring this forth together. Last slide, please. Okay, so this is also one of our priorities in India. I have taken a new role in my work, moved from the regional emergencies, and now as rep of India, it is one of the aspects that we're working with Ministry of Health and Family Welfare, as well as partners in India, to better protect populations against health emergencies. And thank you very much.
Thank you very much, Dr. Reddico, because I'm not saying that I have become a pessimist after listening to your presentation, but more challenging it sounds, because you have shown the capacity of the South Asian regions in terms of the vulnerability and exposure of cascading risks and the kind of health facilities which we have in place already. So that is almost a 50 to 60% of the gap in addressing the issues which is emerging. So this is a lot of challenge for that matter, any of the disasters which you have mentioned. And the pandemic is one. And we are saying that in this pandemic scenario, how to have a public investment should increase for improving the public health system. And what that Edmund also highlighted, that more investment is needed in the planning and also investment in public health to address this cascading risk in the South Asian region. And you mentioned about that on this, not to create everything new, leverage upon the existing one. So how and what kind of a thing which we can place to the entire region for that in time to take future together. I'm inviting the other speaker from Nepal. He's in the planning. So if the recommendations which have been given by all the speakers, and if our country has to take, please stay with us, because I will be going for the round of questions also. But quickly, I would like to invite Mr. B.D. Gautam, who is the Joint Secretary of Planning and Development in Nepal, and he has such presentations and the challenges put forward. And in this scenario, as a spreading disaster, Mr. Gautam, how you see that all these recommendations are boiling down to the national level? And in the planning, you are, as a joint secretary, you must be handling many issues at this moment. And COVID-19 is an additional one. And these gaps are which have shown. How do you react as a national planning in the term of as a government of Nepal? I welcome you and I request.
Yeah, thank you, Professor Santosh Kumar. Good afternoon from Nepal. It is my great pleasure and honor to be a part of this valuable webinar. I will share the documents, the PowerPoint presentations. I would like to share it now.
Please go ahead.
Just going to start. Yeah. Yeah. As all of us know that the COVID-19 is a global phenomenon, and the entire world is fighting to manage it, whether the country is big or small or developed or underdeveloped. It is a global pandemic, but its impact is very local. Even it differs within the same country. So it is more than health crisis, and response to the COVID-19 demands a good blend of health, humanitarian and socio-economic support on the ground, because it is not just a health crisis. So its impact is truly multi-sectoral and multidimensional, as we all of know this fact. And finding the balance between saving lives and the preservations, preserve the jobs and livelihoods is a huge challenge for all the countries. We understand that the situation, nobody is safe unless all are safe. And improve understanding of linkage and intersects between climate-induced disaster and COVID-19 pandemic is vital, because the country like Nepal has to face these two kind of disaster at the same time. As you also know that Nepal is new to federal system of governance, so we are still in the process of settling down the federal system of governance at different level of government. And the local government, the role of the local government, especially this kind of pandemic, to respond to the pandemic is very much important. And our ministry, I'm working in the Ministry of Federal Affairs and General Administration. This is the custodian. The ministry is the custodian of the local governments. We have 753 local governments in our country, including the urban municipalities and the rural municipalities. The role of the ministry is basically to develop the models for the local governments, model acts, policies, manuals, guidelines, tools, and SOPs. And ministry is also working as a pool between local and central government. And ministry, the MOFAGA is working in the capacity building of the local government, including research, innovation, training, and skill developments. For the COVID-19, especially in the COVID-19 response to the COVID-19, the ministry is working with the local governments as the nodal ministry, and ministry has developed a crisis management information system, CMIS, to all the local governments, so that it will be helpful to all level of governments in information sharing. And similarly, the ministry has developed need assessment and planning tool for the local government for the current fiscal year planning, and also COVID response need assessment tool also we provided to the local government. Now we are under preparation the post-COVID socio-economic recovery framework to the local government, so that it will be helpful to have a socio-economic recovery plan to the local governments. And ministry is also facilitating all the local governments to establish their own DRR fund and disaster management committee in all the local government. And we are coordinating the local government at the central level with the different ministries, including the Ministry of Finance and Ministry of Health, all the ministries at central level, to provide the additional fund transfer to the local governments to respond to COVID-19. Also, ministry has facilitated the distribution of relief packages to the weaker section of the society through the local governments. Ministry has provided the guideline to the local governments. And also we have deputed additional staffs under secretaries for each provinces. We have 7 provinces in the country. All the provinces have deployed under secretary level staffs to facilitate and coordinate with the local governments to respond to COVID-19. Ministry also has mobilizing the CBDRM platform. This is the community-based disaster reduction platform. Basically, the platform is all the stakeholders working in the community level disaster management are joining this platform, and we discuss in the platform, share and exchange the ideas and coordinate all the disasters, including the COVID-19 at the national level. So ministry is also coordinating the different development partners to promote post-COVID recovery activities in the field. We have new constitutions in our country in 2015, and for the first time local governments are able to exercise all 3 levels of powers: executive, legislative and judicial powers in the history of Nepal. We have just completed 2.5 years back the local level elections. So we have young and enthusiastic team of elected representative at local level. And the noticeable thing, one most noticeable thing in our decentralized governance is that we have shifted the decentralized governance, local governance model to power sharing model. That means all the local governments are empowered to exercise the executive, legislative and judicial power in their area. And it has changed the role and responsibilities, authorities and powers to the local government. And people also have growing expectations from these local governments having executive, legislative and judicial power. And to operate all the local governments, the Parliament has sanctioned the Local Government Operation Act in 2017, and all the local governments are operating through this Local Governance Operating Act. I already mentioned that the local governments have had the sectoral responsibilities, including health, education, agriculture, and all the other areas. So they can develop and implement their own acts, laws, and regulations, and including the full cycle of DRRM. So it includes.
Can you give a concluding remark?
Yeah. And local governments are also working in response to the COVID-19, basically in awareness raising, distribution of relief packages, supporting in establishment of quarantine isolations, COVID hospitals and testing labs, transportation of migrant workers into the holding centers, isolations, quarantines, all these. And they are also working in psychosocial training and counseling. So these are the basic initiatives taken by the local governments to manage the COVID-19 pandemic. We have some challenges right now because we are entered into the unitary federal system from the unitary system. So intergovernmental relations, there are so many issues within the different level of governments. And the COVID-19 pandemic is new for us because it is a large scale pandemic. So it is very difficult to handle such a country like Nepal. But our local government are playing the excellent role in these areas. Local government have the sectoral responsibility, including the health. Quality of health infrastructure and services demand overwhelming improvements at the national level also. So at the conclusion, it is needed to revisit the scope of DRRM and incorporate pandemic as a major disaster. More holistic, comprehensive and robust definition of disaster is needed because it is new for all the nations, including us. Better understand the subtle nature of pandemic, how it complements and differ from the conventional disasters, and strengthen local government in the areas of particularly digitization, robust disaster database, supply chain, inclusive DRR, protection, disaster governance, and others. Build partnership and collaboration practice, whole of a society and leave no behind approach we have to adopt, and reach to global and regional organizations and benefit from their initiatives in area of multi-country cooperation, research, knowledge building, best practices, exchange and exposure like UNESCAP and even the SARC level and the domestic countries. Localize global and regional knowledge and apply into the local conditions. These are the way forward and conclusions in our experiences. So thank you very much for providing this opportunity once again.
Thank you very much, Vishnu. That this is a very, very important that how in the transition stage, Government of Nepal, which is going from one way of governance to the other way of governance, and it's very highlighted as what kind of a challenges it is throwing, especially during this transition. The COVID is there and also other disasters. Many of the participants who are attending from Nepal, they are also highlighting the issue of 2013 earthquake of Nepal and how Nepal is recovering. And they are also showing confidence in that Nepal will also recover this COVID-19. And we all pray that all countries should move together and we come out from this kind of ongoing disasters. And you have highlighted very well that role of regional cooperation and also strengthening community by the local government. So this is the crux which we are taking it, that how the regional cooperation and other delegates have also said, and which you have demonstrated that how the government of Nepal is taking it forward. So this is very interesting to listen to you, but please stay with us. And dear friends, with the permission of everyone, we are just extending for 15 more minutes to have some kind of a question answer. Many of the delegates are asking questions that how that pandemic, which has actually derailed the whole process of development, could be recovered in terms of lives and the livelihood, where the life is getting threatened, and at the same point of time, that livelihood, like in India, Honorable Prime Minister talked about initially, Jaan is important, and later on, Jaan hai and Jahan hai. So kind of approach that emphasizing on these two. I would just open 10 minutes for the question answer, although I have taken in between a couple of them, which has been given in the chat. And I would just open any delegates who are attending can raise 2-3 questions. We will restrict to 3 questions. 2-3 questions we have already thrown to the panelists, which they have covered in their presentation, like Edmund and Roderick and B.D. Gautam has mentioned in that. So friends, any delegates who will ask, would like to ask question? Professor Menon, you are asking many questions. So would you like to say something? Probably Professor Menon has left. Any other delegates who are attending do they have question? So one delegate, I'm just reading out to the panelists. They are saying, have there been any lessons from the COVID-19 experience for improving the effectiveness of governance in preparing for responding to the recovery from disaster? Professor Vinod Menon, who is a former member of National Disaster Authority India, has asked this question.
Can I
to add on?
Professor Santosh, can you hear me?
Yeah, I've read your question, so I'm seeking response from the panelists.
Thank you very much.
Yeah, any panelist would like to respond what Professor Menon has asked this question, which I've just referred? Any panelist, whether Rodrigo or Mr. Fernandez or anybody or Dr. Mitra?
Thank you.
Okay. Yeah, please go ahead.
I think, Professor Santosh, the question was addressed by Dr. Menon to Dr. Offrin, but nevertheless, I think that in terms of quickly answering that in one line,
yeah,
I think COVID-19 as a pandemic has exposed the fault lines in the approaches towards healthcare systems, particularly in terms of preparedness response from the medical community, and also in terms of addressing surge capacities in different healthcare establishments. Now, when I mean different healthcare establishments, I'm talking about how district hospitals work, how private hospitals are trying to adopt and cooperate, then bringing this urban to a rural context in terms of community healthcare and in terms of then primary healthcare. So establishing an integrated governance mechanism where you have health systems, where you have disaster management authorities, where you have civil society converging to create the kind of ideal situation we envision as policymakers is what lessons we would clearly need to establish moving forward through 2020 and also preparing ourselves for future pandemics. Over to Dr. Offrin for further guidance.
Thank you, Edmund, and thank you, Professor Santosh. On this point, in terms of lessons learned, yes, I think what we have seen is that all the systems have been tested to their limits. So a few overarching points on that. One is that we are not just looking at health systems, but health and emergency preparedness and response systems. And you can stretch that in terms of the preparedness of other sectors, whether they be business sector, the social sector, education sector. In other words, what was not seen in the longest for the longest time is that the development is not seen with a risk lens. We designed our systems, our schools, our hospitals without any information around the possible hazards and risks that they will be facing. So it's not just per hospital, but also as a system. So I think that's where I would like to, because this forum is to impact on larger policy issues. Lastly, our investments are mainly in terms of where larger populations are, where the urban areas are. but I think it should really spread around where subnational areas are and the most high risk in terms of a comprehensive risk profile. Thank you.
Professor Santosh, as a continuity to that, if I may just make one small line, Dr. Offren did mention about the routes for resilience, and the ESCAP policy report recently released points out 4 different risk scenarios which converges one upon the other. So, and it also heavily quotes the route for resilience in multiple references, and also we witnessed this through the talks and conversations of multiple speakers. So my humble submission to all the attendees and invitees out here is to read the ESCAP policy report, which has been shared, which would further deliberate, dwell, and throw a lot of inner highlights into how we could make risk-informed planning a future course of action in our governance systems.
One more question which has come up from that whether this is a concept, multi-hazard management is still a concept or it is ready to practice. V.S. Prakash has asked this question. Any panelist would like to, and one more question I would like to read where I would like to have intervention from Dr. Mitra and of course Dr. Lal. They are asking that whether the BIMSTEC and South Asian nations are going to have a better approach or they will continue with disaster support to the member nations, or they will have certain different strategies now. So maybe we can have first Dr. Mitra and Dr. Lal, and then we will have any, that would be open to everyone as a concept or the practice.
Yeah, so can I speak now?
Yeah, please go ahead.
Yeah, regarding South Asian cooperation under SARC and BIMSTEC, you see these mechanisms are very much in place. And in addition to this, we have WMO mechanism also. But particularly this BIMSTEC mechanism is a more recent one. And I think respective governments and hydromet departments have to come closer. We are already working, for example, this BIMSTEC mechanism. We had a governing body meeting and all the heads of the department or the ministry people came here in 2019. And there are plans and we are executing on that. And this BIMSTEC center is working closely with the members. For example, recently Bhutan scientists came and worked with us. So there are a lot of exchange happening there. But I think we need to reinforce that and work more closely, and particularly the new development in this technology, the models, etc. I think that is the new technology and how to translate that into new products. And particularly, I will tell you something called probabilistic forecast modeling. So earlier we used to have one model. Now we have 45 runs. So there are 50 members. So everybody is now interested to translate the model forecast early warning system into uncertainties there. So if you want to have a very good proof disaster management system, then the uncertainties coming out from this probabilistic system, ensemble prediction system has to be built in. So I think there is great scope, and I think the government and the private agencies, universities, I think we have to work together and translate these new technologies which has evolved in the last 5 years and coming up to translate into measurable products. Thank you.
Thank you, Dr. Mitra. Dr. Lal, what is your comment on this? Whether regional cooperation will remain the same or it will have a different approach now?
Thank you, Professor Kumar, for this, again, an opportunity to respond to it. Both SARC and BIMSTEC are regional organizations which are as active as the member states want it to be. That's how I would like to put it. And there are different mechanisms, different specialized centers, if I may talk about SARC, which can deal with these issues. So and I think we have been collaborating on a lot of areas as well, in different areas on different issues. But the issue is that now COVID has added urgency to the effort that has been put in. And it has also made it clear that different agencies, different areas working on parallel tracks will not reach the objective or meet the objective that we want them to. So we'll need to start working together more and perhaps make better utilization of these platforms that the member states have created. And as SAC centers, we are all there for the member states and we are there to serve the member states. So I feel the mechanisms are there, the frameworks, legal and other, for example, there are different bilateral and multilateral, different kind of, what do you call, discussions and agreement as well. So there's no, I would say, dearth of any legal or such kind of a guiding document. What we need is more proactive engagement from the member states. Thank you.
Thank you very much for most of the questions probably have been answered and taken up, because Dr. Loy Rigo has also had the similar kind of questions, whether it will remain the kind of a study or the practice would change. Mr. Menon has also mentioned, and probably that also been answered. So we are friends. Thank you very much for raising questions and taking this agenda forward for all of us, and highlighting the key challenges which you thought is very, very important and that to be answered by the panelists and also those who gave the introductory remarks. Before I request Dr. Nagesh Kumar, may I request Major General Bindal if he has to say at this point of time anything under responding to all these as a kind of his remarks at this point of time, before we close. Major General Bindal.
And it's good to see Dr. Nagesh also. So this particular webinar for last 2 hours had been totally enlightening, because the different perspective from all the speakers, once it is brought in together, it finally talks about coordination, collaboration, governance, and collaboration between countries as the final, as the main step. And secondly, advanced preparation. Advanced preparation has come out loud and clear that for managing cascading disasters, advanced preparation, which is in the form of preparedness, mitigation, is a key factor, because only if we start, first of all, we realize, like what the first speaker had spoken about, risk-informed policy planning. So first, once the risks are identified, they are understood, and the realization has been there that yes, these risks are substantial and they need to be tackled at the highest level. It is not at the level of community only. It has to be tackled at the highest level so that the fruits of that intervention are seen by the local community, by the last mile connectivity. So that is the start point of the whole process. And once that is studied, so globally, I think there's such studies which INISCAP brings out, 2-3 studies they had brought out about Asia Pacific are very, very important. They're very important in bringing this whole risk-informed policy planning in a global perspective, in a regional perspective. And based on that, the mitigation strategies, the preparedness, advanced preparation that I'm talking about, collaboration, coordination, they all start following, because then once we are aware that what we need to do, then the question is how to go about it. And in that, I think the civil society organizations, the NGOs, the self-help groups, and the think tanks, they must be brought on board by the policymakers so that the grassroots issues are brought into the policy and they are implementable, they are pragmatic, and it is not introduced by some paper pusher who has got no knowledge. So his knowledge, lack of knowledge, can be supplemented by the practitioners, and in that the civil society organizations, NGOs, they're doing a great job. And the last mile connectivity that they're providing by spreading out all across each village and each district level, and the kind of guidance they bring with the resources they have, I think we need to have a major change in our thinking And instead of treating them as a competitor, I think we should treat them as a collaborator, and we should treat them as a part of our planning. And a lot of things will fall in place. I'm very sure with that, a lot of things will fall in place. And they are always ever ready to help. The best part is I've never heard, I've spent so many years, when you go with any proposal or they come with any proposal, it is an ever ready yes. It is just procedural issues which need to be circumvented. Otherwise, there is never a no, whether it be from UNICEF or WHO, FAO, any of the agencies that we talk about. So why not utilize that? And for managing cascading effects of a disaster, it's a multi-stakeholder engagement, multi-levels of engagement, and hence we must join hands. So my final take on this will be that this particular webinar has brought out the issues of how we can deal with cascading disasters. Some speakers have brought out what are the effects of cascading disasters and how, by giving example of like the keynote speaker gave example of Ebola virus. These things have now been understood. The question is, what now? And that is what has been discussed today very well. And I'm sure the report that will come out of this webinar will help the policy planners in a big way in further policy interventions. So with that, I thank UNICEF, Dr. Nagesh Kumar, and all the esteemed panelists and speakers who were there on this webinar for such insightful comments and deliberations. And I thank Professor Santosh Kumar, who moderated the session so well. Thank you so much. Over to you, Professor Santosh Kumar.
Thank you very much, General Bindal, for bringing and committing NIDM's thing that we will be taking it forward. And I'm sure that the third webinar, which is coming, where it will culminate the two, which we have, second one, which we are getting through today, one which we had already in the past, and third is proposed for another 20 days time. And by the time we will be ready with the report, and that report will be unveiled probably in the third one, and it will go to the policy people for all the regional cooperation and the nation, all the member states, where that probably Mr. Nagesh Kumar would highlight as a way forward. But the commitment of NIDM we have taken from the highest authority. Thank you very much, General Bindal, for giving that insight. Before I hand over to Dr. Nagesh, I know the time is running out and it's already over, but I am to say 7-8 things to help you to taking out the way forward, which you can commit at this forum. What starting from what Mr. Rajivan to Professor Rajivan, who gave the keynote address, to until end what the General Bindal has mentioned, all the distinguished panelists and the member states representative, along with BIMSTEC and SARC. A few things which are coming up. One is this: that disaster is cascading and it is having larger impact on the people's life and economy. And this is disrupting supply chain management environmentally. So how, along with the animal and human interaction, what is happening, the chance and climate change, this would not going to be stopped or going to reduce. So we need to look at that as a kind of a larger thing when we talk about uncertainties, and also we talk about unknown and cheap cost at the present generation should be avoided, and taking that to the sustainable model so future generation is not going to. Second is that how this thing should be handled globally with the regional cooperation also. It cannot be handled by one country alone. So that is a major challenge in terms of this cascading disaster risk management, and protecting people to empowerment approach. That is another thing which has come out. And public good as an early warning system as a public good, and where this resilient infrastructure is going to be a new element, and that has to be brought in the planning system of the member states. Another thing which I would like to highlight in terms of integration of multi-hazard models with the health system in pandemic, and there we talk about also that government to governance. That is another thing which came up with the gender equity and inclusiveness, empowering people, role of civil society, and that's another partner, NGOs. And investment in public health infrastructure, as there's a huge gap there in the South Asia, East Asia region, and how that going to bridge the gap for addressing not only one disaster, we talked about the cascading disaster. That is very, very important. And what we draw for the 6 points which happened in the first this webinar, we need to reconnect that the first one and that what is happening, where all the suggestions given there. So that strengthening public policy and bringing new tools for entire disaster management process, revisiting process, where how these regional institutions can play a very, very effective role, and revisiting the entire approach of South Asia nations and BIMSTEC countries. And last but not the least, I would say that the Honorable Prime Minister in India also, the points of recommendations which have come up today is tallying with the Asian Ministerial Conference, what he highlighted, of 10, 4 Prime Ministers. This point has come up in very well in this, reiterated by all the panelists from different region, different perspective, but it has come up very, very well. So I would like to extend my heartfelt thanks to UNSCAP and to BIMSTEC and to SARC Health Center and my own team, Major General Bindal, and also Dr. Radha, Dr. Balaji, and our entire team, which is helping us. Dr. Sanjay Srivastava there from SCAP, and Dr. Nagesh, personal heartfelt thanks to all of you for bringing us together. Now it is your take that how you are addressing this audience, those audience who have been there and especially asking questions and highlighted those issues. They want solutions and how we are going ahead from here. They wish to know. So I would like to hand it over to you. But before that, I extend my heartfelt thanks to the keynote speaker, Professor Rajivan, and to all the distinguished panelists from the nations and from UNSCAP. I'm grateful to everyone, each one of you. Dr. Nagesh, handing over.
Thank you, Professor Santosh Kumar. And I want to begin by thanking NIDM and General Bindal and his very strong support for this webinar series. I think this has been very productive collaboration. This second in the series, again, has built on the discussion of the first one. And, the past 2 hours have been some of the most enlightening, minutes or hours for me. It was very interesting to listen to very knowledgeable and senior experts giving their insightful remarks. So I really do not want to add to what has been said, and Professor Santosh Kumar and General Bindal, you have summarized the key highlights of this discussion, and we will be putting together the highlights and takeaways in a publication. So I don't need to summarize what was a very rich discussion, just to underline 4 big picture messages coming out. And I think what came out from this is that South Asia has emerged as a very big hotspot for multi-hazards, whether it is natural disasters like earthquakes or tsunamis, or climate change related disasters like droughts and floods. We are facing currently a lot of floods in this sub-region, and the health risks, health hazards, biological hazards. So all of them coming together, and South Asia is the worst victim or most vulnerable sub-region. So, and poverty and inequality which exist in this sub-region make it very complicated. What has also come out is, again, one big picture issue that we need to deal with these multi-hazards. We need a very integrated approach, which pulls together all different parts of government and society. So whole of society and whole of government approaches. Otherwise, we are not really doing good service to them. It has also highlighted that some of the SDG goals come in very handy. Their importance, whether it is universal social protection, universal social protection and universal health coverage, or and sanitation and all other aspects or other targets of SDGs are really required to deal with this kind of a cascading disaster risk and manage them. So we need to pay attention to expediting the SDG achievement, and with that, and in fact, the disaster resilience is part of the SDGs itself. So we need to move on the agenda of sustainable development goals much more vigorously now that we have seen how vulnerable that we are in this region. The other thing, again, a lot of people have emphasized that is the need for multi-hazard early warning systems. And, these should be seen as public goods, and we should invest in them and not postpone them for future. And then, because these hazards are affecting all the South Asian countries together, it is a shared challenge, common challenge. We need to deal with them together. And so regional cooperation's message has been repeated nearly in every intervention that was made today. And so this is something, coming out, and a universal and, unanimous view that regional cooperation, at least in managing risks and disasters, is going to be extremely critical. So all the regional organizations, whether it is SARC, BIMSTEC, or UNSCAP, and any others, will need to really push this agenda of regional cooperation to make this sub-region more resilient and better able to meet the challenge of these multi-hazards and disasters. So I think this message is really coming, very strongly, very forcefully, and so we need to push the envelope and do more, pull up our sleeves, and work together and work with the governments, the stakeholders, and the society at large to push this agenda of building resilience. And for that, we need really support of all different parts of the society. And I think this seminar series or webinar series itself is a result of very productive collaboration between NIDM and the regional centers and regional organizations, including BIMSTEC Early Warning Center and the SARC Health Center and UNSCAP. Of course, we have to continue this journey and this challenge together, deal with this challenge together. So on that note, I want to really thank everyone who participated in today's discussion, today's webinar, and all the very distinguished speakers of today for enlightening us. And we will continue to remain engaged with all of you for really dealing with this challenge more effectively. And I want to just leave a final thought that in this webinar series, I think the key drivers are two. One is Professor Santosh Kumar, who is our moderator, and Sanjay Srivastava, my colleague in UNSCAP. So they have been the real locomotives of this series. And so I want to really thank both of them for doing a very good job of pulling all of us together and providing a platform of a very rich, very interesting and insightful discussion. Thank you very much. Over to you, Professor Santosh.
Thank you, Dr. Nagesh, since you are the head of the South Asia UNSCAP, so largely weighhead is on your shoulder much more, along with the other bodies, along with the SARC and BIMSTEC the national bodies like NIDM has been empowered by the Act to take any international thing also on the perspective. So as a forward-looking mandate given to National Institute of Disaster Management can do the needful along with the regional bodies like yours. And so very nicely that say that COVID-19 is talked about testing, and testing. And we said that cascading disaster effect could be resolved by cooperation, cooperation, cooperation. So this could be taken as an ending note of today's website. I wish to extend once again heartfelt thanks to everyone, to you in person, and also to everyone in your team, Dr. Sanjay and Madhurima, and all in our team, and General Bindal from NIDM, and all the panelists and all the distinguished delegates who participated on behalf of the National Institute of Disaster Management, and all the co-partners, BIMSTEC and SARC together. We extend our heartfelt thanks to once again to everyone, to every government. And we will the next webinar where the next member states would be invited. Like we had invited almost 6 and we are 2 remaining. So we will try to engage everyone from the South Asia region. And also we would like to have a BIMSTEC. So with this, I take the permission of closing it by extending my heartfelt thanks to my team, Dr. Radha, and also Dr. Balaji for support. EDNIDM, do I need to close now and permission to close? Probably it's not there. So,
yes.
Thank you very much. Yeah, thank you very much, General Bindal, for this giving this talk. And this webinar stands closed now. And thank you very much to everyone.